Semaglutide is for really any patient that is what we consider obese, so a body mass index over 30. It's also appropriate for patients with a body mass index above 27, so someone who's overweight but has other comorbid risk factors. So they may have high blood pressure, they may have high cholesterol, polycystic ovarian syndrome. There's several other comorbid conditions that could qualify a patient. What semaglutide is not for, patients looking to maybe lose 5 or 10 pounds, someone who is very thin, who may have a problem area that they're just looking to lose a few pounds. This is really for someone who is at least in the overweight, if not obese category. So here at Plaza Aesthetics and Wellness, we have a very comprehensive program. When a patient is initially interested, we do a phone call, which is a screening just to make sure they know a little bit about our program and feel comfortable coming in for the full consult. During the complimentary consultation, the patient will see myself. We'll review kind of the risks versus benefits of semaglutide. We'll discuss their past medical history, any medications they may be on, and determine if it's appropriate also based off of their weight and goals. And then at that time, if the patient does decide to proceed, we would go ahead and order the medication for them. It could take a few days up to a few weeks to obtain the medication. And once the patient is able to obtain the medication, then we would go forward and start the program. Patients who do decide to go forward with a semaglutide weight loss program here at Plaza Aesthetics and Wellness, we would like to see them at least the first few months weekly. If a patient is coming either from out of town, several hours away, occasionally we can do like a bi-weekly visit, or we could even do phone or Zoom visits in between. Patients are either seen by myself or my nurse weekly. They're also seen by our registered dietitian page weekly. So we have very close monitoring for this medication, which is very important for numerous reasons. First of all, if a patient has side effects and they're unable to tolerate the appropriate titration schedule that we have as kind of a rough guideline, we can kind of alter from that. And then also what's most important in a weight loss program, even more important than the semaglutide itself, is the behavioral modification. So it's very important that patients are tracked closely, that they have that monitoring, that they're held accountable, that they're coming in for weekly weigh-ins, they know that they have support. So that's something that we offer here at Plaza Aesthetics and Wellness. So for semaglutide, there were 2 clinical trials that were done on GLP-1 receptor agonists that are in the same category, that are brand named. And for what we were seeing in the clinical trials were that patients titrated up on the medication or got to the max dosing after about 5 months. And that's when they had the largest amount of weight loss. They were then continued on the medication for at least a year. Patients can then at that time be either abruptly withdrawn from the medication or titrated down on the medication. We do not recommend abruptly stopping the medication. That would be something that you could kind of get a rebound effect. We also recommend, if you are going to do a titration, that we're involved in that just to make sure you don't have a rebound and you don't have any symptoms that could be consistent with tapering off the medication. But really what's most important is anytime a patient signs up for this medication, it may be something that they personally need to take lifelong. So if you are interested in semaglutide and it's something you just want for a few months, probably not the best candidate, or at least not a best candidate, best fit for the services we offer here. We want patients who are in that overweight, obese category, who are committed to the medication, know that they're going to be on the program for at least 6 months. At that time, we'll determine if we'll continue at that dose, titrate down to a lower dose, or titrate slowly off the medication. But what we saw in the clinical trials were that patients were the most successful if they stayed on the medication long-term and committed to long-term medication management.